Moving on to other news making the headlines this morning. Now, despite an abundance of remain a major problem in Africa, and this problem has been associated with most of Africa's developmental challenges. In the light of this, the Global Citizen at an Advocacy Program in Lagos, southwest Nigeria, called for an urgent need to end extreme poverty in Nigeria and the African continent at large. News Central's Omolola Ololade tells us more in this report.
An extreme issue that we have and we face.
Poverty reduction cannot come by accident, but through conscious and concerted effort. On this premise, Global Citizen, an international advocacy organization, organized an advocacy program to break in the systemic barriers that will not only end extreme poverty in the country by 2030, but actually help refocus the urgency to do so before the stipulated time.
We're launching our global policy white paper today because as an organization, our mission is to end extreme poverty by 2030. But because of the impacts of the pandemic has really set us back from achieving the Sustainable Development Goal. So as an organization, we sat down to think about how do we refocus our vision on achieving those SDGs. We wanted to really emphasize the urgency of ending extreme poverty now. So our mission changed, and with that, we have the white paper to support that.
While the prevalence of poverty in the different sectors of the economy remains a challenge to ending the menace, stakeholders emphasize that having access to food and basic health care will go a long way in bringing an end to extreme poverty in the country.
We can't talk about poverty without hunger. Can't talk about hunger without poverty, right? So what they are doing by this launch is to create that sense of urgency and calling all stakeholders and all the players on board to see a reason why action should be taken and why support and partnership should be driven.
Healthcare must be accessible and affordable. And the best way to achieve this is not just saying we will wait for the government. So the best thing is we need to have more local private sector working in hand with grassroots leaders to actually fund projects that actually will make healthcare affordable and accessible.
With Africa being the continent with the highest number of out-of-school children and Nigeria being at the top of the list, the role of education in ending extreme poverty cannot be undermined.
We need to make better facilities, school feeding, ensure that in terms of menstrual hygiene, girls have that, a robust curricular activities, mentorship for the girls, mentorship for every child, and then most importantly, continuous exposure and, if possible, some kind of repercussion for families that refuse to let their children go to school.
Effectively tackling poverty is a feat that can undoubtedly place Africa on a pedestal to be socially, economically and politically sustainable. Omolola Ololade reporting for News Central.